everybody, welcome to Just Upright. My name is Doc Jean Ruder. I'm a doctor of physical therapy and I'm a certified dementia practitioner. If you are new to my channel, welcome. Please do not forget to hit the subscribe button below. It will mean so much to our small business. It will mean so much to me and my team. Thank you so much. And also please check our Facebook page, justuprighttherapy.us. We also have the Instagram account and we also have the TikTok account. Follow us on those social media. I also have 3 books published and the links will be down below. I made the books for foreign trained physical therapists on how to apply here in the US, the step-by-step guide. I also have practical tips for therapists before starting their US practice, and also Just Upright Therapy book to improve posture, balance, and decrease fall risk among older adults. So all the links will be down below. Alright, so for today's topic, I'm going to discuss one of maybe a controversial thing about having sickness, especially among older adults. You know, when we do a chart review in the nursing homes, or I work in the hospital to before and home health, so we read all the past medical history, what are the conditions that the patient had or has during evaluation. This is very important for us therapists so that if the patient presents with signs and symptoms, we will be able to recognize them during therapy. But the chronic conditions or the chronic diseases causes a lot of problem in the society. A lot of medical burden, hospitalization, rehabilitation, therapy, medical costs uprise. And we're going to discuss whether these chronic conditions are from the genes and we should blame the genes, or is it from the choices, okay? Is it the lifestyle that we choose, okay? It is not uncommon when I interview a patient and I want to confirm, are you diabetic? And the patient will say, yes, my mom was diabetic, my dad was diabetic, my grandmother was diabetic. It runs in the family. Okay, so there are factors, genetic factor that predisposes an individual to get sick, and there are indeed hereditary conditions that cause a person to be sick. But these chronic conditions that we're going to discuss are, for example, the heart condition, okay, diabetes, kidney failure, cancer, stroke. There's a research study that was done in 2016, and that will be my reference for this presentation, that look at genes or the genetic factor and answer whether it is a major factor or a minor factor for someone to get sick. Okay, so first we're going to discuss, according to CDC, what are the chronic conditions and how prevalent these chronic conditions among the population here in the US, and then we're gonna dive in and discuss what they found out in the research study. Okay, so let's hop on and learn. So the title of the research study that I use is Genetic Factors Are Not the Major Causes of Chronic Diseases. So it doesn't mean it doesn't play a role, but it is not the major cause. Okay, we're gonna dig into it deeper as we move forward. Okay, so first, let us discuss what are chronic diseases. Okay, so this information came from the website of the CDC, okay, National Center for Chronic Disease Prevention and Health Promotion. Okay, so the chronic diseases, these are very serious. According to CDC, 6 in 10 adults in the US have a chronic disease, so at least one, and 4 in 10 adults have 2 or more. Okay, so we're not living in a very healthy society here in the US. So when we talk about chronic diseases, we're talking about heart disease. So it can be coronary artery disease, it can be congestive heart failure, it can be myopathy, among other heart conditions, cancer, breast cancer, leukemia, ovarian cancer, prostate cancer, to name a few. Chronic lung disease such as COPD, asthma, okay, and other chronic conditions, stroke or CVA, Alzheimer's disease, okay, Alzheimer's disease, under that is dementia as well, diabetes, and chronic kidney disease or kidney failure, okay, people who especially at the end stage needing dialysis, okay. So these are the chronic conditions that we're talking about, okay. And just like I mentioned before, these are very common when I do the past medical history, the medical conditions of my patients. You can always see this in combination, okay, among all other diseases that they have. Okay, so this is really a serious matter. As we grow older, a lot of diseases are coming out as well. Okay, so this is the research study that I'm using for the purpose of this presentation. Okay, it was done in February 26, 2016. They received it and accepted in April 12 and published in April 22, 2016. Okay, so this is done by Stephen M. Rappaport, School of Public Health, University of California, Berkeley, California, here in the US. So this is a very technical research study, guys. So he actually looked into the risk acquiring chronic disease is influenced by the person's genetics and exposure received during the lifetime of the patient, plus their interactions, the interaction of the genes and the exposure. Okay, so what they found out in this research study, okay, there's a table that says global deaths attributed to exposure risk factors for chronic diseases. Okay, so let's go through it. Okay, so we have tobacco smoking, okay, indoor smoke, ambient particulate pollution, so if you live in a very polluted area, high sodium diet, alcohol use, low in seafood omega-3 fatty acids, lead exposure, secondhand smoke, diet low in polyunsaturated fatty acids, okay, high in trans fatty acids, occupational chemicals, drug use, ozone pollution, low in calcium, vitamin A deficiency, iron deficiency, radon, residential radon, zinc deficiency. So as you can see here, this exposure risk factors, in my mind it says lifestyle choices. So it's not all lifestyle choices by all means, because there is like the pollution, the factors involved outside of our control, but most of this are within our control. Like, are you a smoker? Okay, the diet, okay, the choices that we make. Are we eating a high salt diet? Are we eating high fatty food, the bad fat diet? Are you using drugs? Okay, those are some of the lifestyle choices here that can cause us to be more sick, okay, as we grow older. Okay, so the other ones are deficiency in vitamins, in iron, in zinc, the deficiency in the nutrients that we put in our body. Okay, so what they come up at the end of the research study is this table. Okay, so as you can see, this is the Western European deaths, 2000 in thousands. Okay, so as you can see here, the red one, deaths attributed to genetics plus shared exposures. Okay, so people with heart disease, okay, the genetic factor here is very small compared to the lifestyle choices or exposure, okay. That for the cancers, it's the same. So even though we have predisposition to cancer, the genetic factor to having cancer is very small compared to the lifestyle choices and or exposure. Okay, so there you have it, guys. As we read from the research study, okay, genes have a very small influence in developing these chronic conditions, the heart condition, the cancer, as you saw on the graph. And then the key is that the lifestyle that we choose, okay, the lifestyle choices, the diet, the exposure to smoking, alcoholism, drug use, those are major factors why people are getting sick. Do genes have a factor to it? As you saw in the research study, yes. Is it a major or minor factor? It is a minor factor. The major factor is the choices that we make. Of course, there are factors beyond our control, the pollution, the ozone layer, and the chemical exposure. Those things may be out of your control. The radon gas in your house, if you didn't know it, it was there. So there are things that are not within our control, but for the most parts, there are major things that are within our control. And one thing that I'm learning in working with older adults, working in nursing home, is that you cannot get away with anything. The choices that we make as we are young and going forward, going to older adult, really affects how we live in the future, okay? If we choose to abuse ourselves, we will not be invisible, we will not be untouchable, we will not be healthy all the time. As we grow older, the fruits of what we have done to our body will be manifested in our older adults. But if we choose to take care of ourselves the best that we can, it's not a guarantee that we're not going to be sick, but we may live a healthier life, a happier life, a longer life, filled with precious moments with our family members, with our loved ones, with our friends, instead of lying in bed, being cared by a stranger or someone, or being far away in a nursing home because we don't have the help that we need in order to enjoy the life. Okay, so I hope that this is an eye-opener, not just for me but also for you. This is like empowering us that we have a choice, we have a say. What will our later years will look like? We have the power to choose whether we're going to be a blessing or a burden to other people, to our family members, or we're going to have a good quality time with our loved ones as we grow old and enjoy life and enjoy this world before we go to the next level. Okay, so thank you so much for watching. Please hit the subscribe button. Please share this video to your friends, to your loved ones, to your sphere of influence. So until the next video, stay blessed.